Hello, this is Dr. Raul Vasquez. Some of the concepts that we want to talk about is the New York State Health Exchange. I think it's real important that people begin to understand how important this will be in their health. And as a physician, I hope to kind of enlighten you with some of the information that's out there. So this is actually put together by the council, Lisa Sabrana, but what we wanted to do is kind of bring it out there and put it on the web and make sure people understand the impact that they have on deciding how these policies are put forth, and that there's an open forum right now for grassroots to kind of talk about what's expected with these new health changes. So what is an exchange? I think what's happening is you're putting all these health plans into an arena where they have to compete for your business, and I think that's where it's important. And you're making tax credits and cost sharing, subsidized. All these pieces are taking place as part of the Affordable Care Act. So they will there's a $500 billion that was allocated to the plans, and this is how the dollars are going to be accredited and utilized through this whole process. So two programs are being put together. There's the individual exchange, and there's the shop, what they call employed exchange, for small business health options. And so who qualifies for this? It's real important to see. You have to live in New York, be under 65, citizen, and you can afford health insurance coverage through your job or your spouse's job. Own or work for a small business with about 2 to 50 employees. Now, the function of the exchange has it talks about eligibility here, and it talks about certification. So eligibility, there'll be a toll-free number. There will be web portals for eligibility, ability to calculate your actual cost of coverage, certify individuals as exempt from individual responsibility. The other side of the equation is that we have certified, qualified health plans that will make sort of eligibilities for dental, eligibilities for the essential requirements that are going to be necessary as you ensure that they have adequate supports for their network plans. Now, the key accomplishment to date, I mean, they awarded the dollars, 5 regional activity advisory committees were set, and now the background research is being put together, the IT infrastructures, and all these other pieces are unfolding as we speak. And they received the certification from the Health and Human Services in December of 2012. Now, full implementation of the exchange will bring 1 million people will gain insurance. And of this, 615,000 will be part of the individual exchange and 450,000 from shop exchange. Now, this will decrease premiums as a result of more competition, and so that with the $2.6 billion federal tax credit per year for both of these exchanges, it should help alleviate a lot of the problems that we're running into now in healthcare. Now, the tax credit, this gives you an example. So if you're single, making $17,000, 148% of the federal poverty level, your estimated monthly premium will be $55. Is an annual tax credit of $4,742, and that would be what people are kind of looking at an annual premium of $5,400 per year. The exchange, if you break it up, it gives you the percentages of in terms of under the federal poverty level to above 400% of the poverty level, and you see the breakup for both of these players. As you see, the shop, which is small business, it's more over the poverty level, and when you're looking at the individual, you're looking at more in that 138 to 200% of the federal poverty level. The race breakdown for both, if you notice, Hispanics are making 20% of the individual, African Americans 11%, and on the shop 21% and 10%. So these are some of the numbers that you're seeing. The language breakdown, and it gives you an idea of how the languages are going to be introduced. So in terms of language accessibility, they're looking at if there's a language more than 5% of the applicants, then more integration of materials will be utilized in those languages. For now, Spanish is the one that's being incorporated, but they're hoping as a result of all this availability of different languages to be able to provide these services in multiple languages. An IPA Navigator, this is an RFA that was released. So you've got different entities coming into the team and having a sort of a navigator for the patient as they go through these insurance process to understand what they're getting into and understanding the product. I think it's real important when you create something like this that patients are engaged, and the more information, the better. The goals, again, this is where I think the key thing is, the grassroots outreach. You want to raise questions about the exchange. I think as physicians, we want to make sure that, because now the insurance companies are supposed to utilize not the 40% they used to have for administration, down to 20. So we want transparency. We want to make sure that those dollars are being spent on things that are not going to change the model. And the ones that are spent on healthcare, we need to know how they're being spent also. I think accountability for everyone's real important, and transparency. There's a sunshine law in pharmacy where you have to, in pharma law, but we don't have anything like that in managed care. And I think as the exchanges are being put together, we need these kind of entities. We need entities that take pharmaceutical, really, you've got these managed care products that are really serving three arms of government, and some of these things have to be pulled away and maybe used by the exchange to make sure that a standard formulary is looked at in such a way that's beneficial to the patient. I think that's important. I think knowing how the dollars are being spent, whether it's meals with the Department of Health, individuals, all those dollars need to be tracked because it's important to make sure that they're being utilized in a way that's going to be effective for our healthcare system. And I think it's an accountability that we haven't had. I think these changes and some of this public forum needs to talk about these issues. So we need a sunshine rule for managed care, just to make sure that, again, things are transparent and we don't run into issues. Now, customer assistance and enrollment support, it's going to be online, in person, phone, so there'll be a lot of access points for patients. Again, the timeline, now the grassroots outreach activity begins, and then the health plan selection. We want to be able to kind of grade these plans also based on different experiences from patients from different backgrounds, and I think that's the only way that you're going to know what kind of product you're going to get, and it's important for us to kind of look at that. As a physician, I'm engaged, and I really want the patients to be engaged, because at the end of the day, it's about our health. healthbenefitsexchange.ny.gov is the beginning in terms of the website that'll give you more information if you really want to find out more about this. Again, this is Dr. Vasquez from Gbuahn, and thank you for listening.